right, we are recording. All right, second time's the charm, right? We'll try again. Good morning. Thank you for being here. I just went over the agenda, but real quickly, I'll review again. So we're going to be talking about why are we making these changes for case management redesign? What are our goals for the rule updates? Who's doing what? What are the roles and responsibilities of everyone involved? And then I will pass it over to HCBS Strategies, who will talk about our new rule structure and how we're going to be getting through all of the rules. So what is the format? What are the listening logs? How will the department be responding? And then we'll talk lastly about where you can find all of the updates, all of the meeting materials at the end. So we'll go to the next slide. So rules are required to be updated for case management redesign because we are changing the structure of case management agencies in Colorado. So case management agencies will, moving forward after the RFP or as a result of the RFP coming out, will provide case management for all 10 waivers. So this will encompass the current responsibilities for case management of the single entry point, community center board, and the private case management agencies. So this impacts rules basically across the board. So what that means is that everywhere it says single entry point, CCB, or private case management agency, we will need to bring that into alignment with what will be expected of case management agencies after case management redesign. So that means opening up almost all of our home and community-based services rules. So because of that, the department conferred with leadership and staff and decided that this would be a really great time to reorganize our rules, make them a little bit better for everyone to understand and to follow and to find things. So that's a little bit of our why. We'll go to the next slide. So through this process, our hopes for these updates is to be able to reduce the duplication that we have in our rules, to remove areas of the rules that are obsolete or not applicable anymore to case management and HCBS, and or home and community-based services. I'll try not to use acronyms here. We are hoping to clarify, roles and responsibilities for case management agencies, case managers, providers, members, and putting that all under and into a structure that is easy to follow, easy to understand for anyone looking for what they need within our rules. So as you can imagine, that is a big task. I believe we are looking at almost 300 pages of rules. So we need to make sure that we have roles and responsibilities laid out and that we have a path forward for us. So let's go to the next slide. So for the meetings about these rules, we will be meeting approximately every other week between now and mid-April. And so we want to be clear about what the department and contractor roles and responsibilities are. So myself and Nicolette, who you met over on the Zoom side if you were there, we will be responsible for really guiding the process. We are going to be monitoring and moving conversations along. We'll help walk through what changes are happening. We'll be working on timekeeping, making sure that all the questions in the queue get to the people who need to be answering them, and overall just kind of managing the flow of the meetings. Next, we have department subject matter experts. And if you are here as a department subject matter expert, will you just raise your hand so that folks can see your name and face and know who you are. So I see Lori and Cassie. Who else? Leah, Lana, Michelle, Katie, Trisha, Julie. And this is just a handful of our subject matter experts. So thank you all. You can put your hands down unless you want to come on the mic and say anything. But our subject matter experts are the folks that are really responsible for the actual writing of the rules. So they will be addressing questions or concerns, comments as they relate to the rule updates or changes. They'll be supporting with guidance about, why a change might need to be made, and putting language to your specific input and requests and comments. So that's their role. They are the ones really doing the heavy lifting outside of these meetings. They are the ones that are finessing all of the language, that are coordinating across teams to make sure that everything is cohesive, that we have all of our ducks in a row when we come present to you all. And so, of course, we also have a contractor here with us, CBS Strategies. So if you guys will raise your hands, and they'll be talking here in a couple minutes. We have Steve and Andrew. And they're really going to be doing a lot of our prep work, making sure that we're keeping things in order, that they're updating the listening logs, they're updating the log for issues for further discussion. They're going to ensure that the department is providing follow-up in a timely manner. They're going to assist with walking through the rule changes and really doing a lot of that kind of back-end work to make sure that your comments and your questions are reflected in effectively in the changes that are being made. So those are our roles and responsibilities. And of course, we're all here because we want your input. We want your feedback, your comments, your questions to be answered about the rules. But it is a lot to get through. So we'll go to the next slide. How in the world are we going to get through 300 pages of rules? So it is going to be a well-oiled machine by the end of all of this. I'm sure of it. So the department will, basically the structure will be that the department will present updates to specific areas of the rules at each meeting. And we will pause for a designated time frame for input from all of you. And that input, that might be 10 minutes that we pause, that might be 30 minutes. It will depend on the number of questions that we get. We're making some educated guesses about how long we might need in each for each section, but that's definitely flexible as things come up in the meetings. So all ideas, questions, concerns will be added to the listening logs and posted on our website that I put in the chat, which I can do again here in just a second. And any issues that come up that maybe sort of tangentially related to a rule, but not specifically related to that topic, will be added to a log called Issues for Further Discussion. And this will be sort of an area where this will be an indication to department staff that we need to dig in a little bit more with our stakeholders about that particular issue. So it might require an extra meeting outside of this. It might require some sort of survey or other method of input that we might need for that particular topic. And then last, if we do happen to run out of time, there are just so many comments or questions about a particular topic, we will have a way for folks to respond. You'll either be able to put it in the chat, or we will have a Google form for you all to fill out afterwards. So I hope all of that makes sense. Oh, the other thing that I did want to address is that I know that we are having this meeting at the same time every other week, and that there might be some folks that this might be an inconvenient time for them. And so we are recording this one today. We don't have plans to record all of them. Partially, we want to make sure that people can keep the confidentiality, but we will have they will have an opportunity to give feedback about the rules, similar to how a public comment period works, with sending in comments through that form or to an email address. So that's the structure of our meetings. Any questions about the process or that structure? You can either type something in the chat or you can take yourself off mute.
And we will be walking you through the specific tools that we're planning on using for implementing this.
Yes, yes, that will be the next thing. I'm going to hand it over to Steve here, and he's going to walk us through the specific tools. Yeah. Jesse asked, will these meetings continue in this form, or will it be via Zoom ongoing? We will go back to Zoom from here on out. We'll get this, the issue with the host figured out. On the department side, we don't host our own meetings. We have sort of a Zoom room, and so we have to get special permission for people to be hosts, and we'll do that moving forward. Do the content experts include people with lived experience accessing HCBS? So I'm going to answer this question two ways. So some of our HCPF staff do have lived experience. That is part of our hopes for our staff, is that they would have lived experience with the systems that they're working with, but not all of them do. And that's part of why we're coming to the stakeholder group as experts in accessing the system and really giving us that feedback about what you all need in the rules and regulations. Anything else about the structure? Oh, Jenna, I see your question about putting the call-in number in the chat. Let me grab that for you, and I will grab the website. And I think if there's not anything else, I will go ahead and hand it over to Steve. Are you the next person?
Yep.
Great.
I believe so.
Will you just do a quick intro for yourself and Andrew, in case anybody hasn't worked with you before? I know you've been working with Colorado for a long time.
Sure. So I'm Steve Lutsky. In terms of my background, I actually got into this when I was 20 years old and was volunteering in a nursing home, and was really appalled by a lot of the things that were happening there and wanted to change the system. So I ended up then going to school, getting a PhD in as close of an area that I could figure out and how you actually change how LTSS is provided. Did some consulting and kind of got a good background on things, and then ended up heading up all of the Medicaid-funded LTSS for DC. Then became a division director for CMS and oversaw all of the technical assistance, including the original development of the Aging and Disability Resource Center and Money Follows the Person efforts. Since leaving CMS, I established my own company, which I wanted to do specifically because we wanted to do the work to help to change the system. We view ourselves as a mission-driven company, and for all of the staff that we have involved, that's one of the key things that we look for. So we have worked with a variety of states on a variety of different things. We started working with Colorado in 2014 and redesigning the assessment process, and got very familiar with the Colorado stakeholders and kind of the high level of expectations of it. That I do want to say that the Colorado stakeholders are probably the strongest in the country. That you guys are, very knowledgeable and provide some really great input, and we learned a lot from you in working on the other projects. Andrew Solinsky is working with me on this, and then we have Trevor Wong, who's not here today, who's also going to be assisting on that. Andrew has been working on this project since the beginning. That was shortly after he started with the company. Andrew, is there anything you want to add?
In this project being 2014, beginning the assessment and support plan, not earlier this year when we started the rules project. So I've been around Colorado for quite a while as well.
So one of the projects that we've been working on is the case management redesign, and as a component of an earlier scope, we started looking at the rules and how the rules would need to be potentially restructured. And it really struck us how fragmented the rules were, that the rules for the individual waivers kind of developed in their own silos, the CCBs versus the SEPs developed in their own silos. And in case management redesign, where you're trying to integrate things, that the overall structure of the rules worked contrary to that. In addition, we thought that it was kind of confusing, that the purpose of the rules is that you want to give clear instructions for everybody about what are the expectations for them. And if you're a case management agency, you've got to look in pretty much every single one of these places to be able to figure out what applies to you. Same thing for service providers. There's multiple different places you have to look for the content and the requirements that apply to you. And it's challenging for the state when they're looking at potentially making changes to them, just because you need to be making changes in multiple different places. And we've found places where it kind of evolved differently in one place versus another place, so the language is slightly different. So hence, we thought it made sense to kind of really try to integrate this. And as long as you're going to be redoing it, set up a structure that's going to be clear to everyone. So what we've proposed is that the overall structure is, first you talk about, here's the things that just apply to the waiver and the program overall. Here's the overall specific requirements that apply to that. And then looking at, here's the case management agency requirements and those specific requirements for it. And within each of these sections, it would be like, here's the requirements that apply to case management across the board. Here's some of the requirements that are specific to an individual waiver, and here's the requirements that are specific to an individual service. Next is the CCB requirements, because there will be some remnants of the CCB under the case management redesign. Then the actual services, getting to the specific requirements for the services and each of the individual services. If there are differences across the waivers, like different caps or something like that, that would be a subsection for it. First, it would say this is what applies across the board, and then delineating if there are any specific differences for the services. And then lastly, the requirements for the individual providers that are not covered in some of the other sections. So if there's things about staff hiring or something like that, that would be fitting within there. So I think we can open it up and see if there's comments or input about the rule structure.
Hi, Steve. It's Amanda. I work at the Resource Exchange. I actually worked with you guys a few years back on one of the pilot programs. So nice to see you guys still hanging out. I did have, so when you say new rule structure, is this waiver program overall requirements, like we have 8.300, .400, .500, .600, is this all 8.100 and then everything else falls within that, or are they still different?
That's going to be all within, the idea is to put it all within one section and all together, and so you're not going to have to be searching across multiple different sections.
Thank you.
Can I just interject real quick? We're going to be pulling out all of the rules and putting it in a whole new section. So if that makes sense. So currently it's across, 3 or 4 or 5 different sections of rules. We'll be pulling all of it out. This will be the structure in a whole new section. Does that make sense? Yeah.
Okay, and Jesse was asking, has the rule structure been developed with the help of the CCB agencies that are successful in their processes and procedures? That's one of the things that we would want to be. The rules aren't going to go, in many cases, aren't going to go down to the levels that are specifically going to prescribe what they have to be doing for actually operationalizing things. These will set the overall expectations for it. So as we're reviewing the rules, if you were at a CCB or at another agency from it, the type of input that we want to get is if there's a change that's going to be made or something that's existing with an existing rule that prevents you from running your operations in a way that you believe is efficient and effective, that's the exact type of input that we would want to be looking at. We've tried to set up the overall structure, and I know all of the SMEs in the department are considering how this impacts the actual individuals and the providers on it to be able to make it more efficient. But obviously you guys know your operations, the people who are receiving the services have a clear idea about what is potentially preventing them from getting the support that they need. So that's the type of input that we need from you during this process. And Christy has raised her hand. Go ahead, Christy.
Yeah, I am wondering what is the plan to ensure that there is consistency across rules with CDPH&E?
Well, there's the overall plan is by if there's similar requirements across different waivers or different programs, is to have them in the same place and just state them once, so that they structure here just like things that apply across the programs and should be the same, then would be at a higher level. It would only be that when you break down to a specific waiver or specific service that it would allow to be different. So the structure leads towards questioning whether there should be any difference in how any service component is defined, because you'd have to then break it out into subcomponents. So, first you want to be looking at the overall requirement for it. And if there is a different requirement for a particular waiver or a particular service, the SMEs are going to be asking themselves, does that make sense? Do we need to have that? Is there any reason why it needs to be different? And if there isn't a good rationale for why that should be there, then it should be set the same across programs and services.
I guess what I mean is I feel like we need to have a subject matter expert from the public health department to watch for some of those things, because in addition to the complexity of the volume of rules in HCPUF's chapter 8 or volume 8, there is crossover with rules from CDPH&E, and we've got, if we're going to take an opportunity to try to streamline and address those things, then we need to address it across all of the rules that affect us.
Okay. That is good input. I know that as part of the rule design, there's references to a lot of other sections within the rules on that, and that would all have to be revisited. We do want to note, that we need to kind of practice a little bit of the serenity prayer. The department controls their own rules that are overseen by other entities, that they can have conversations with them and provide guidance with them, but they wouldn't directly control them. Okay. Other input. Okay, Julie's saying that they sound really good and easier to navigate. Great, that is what we want to hear. But if we are not on track and you guys are seeing problems with this, we really want to hear that. The sooner that we hear that, the better, because then we'll be able to make course corrections. Okay, I'm going to move on. Okay, now within the new rules, there's going to be documents that are going to be presented to you all. And we're trying to do a format for it that you can kind of clearly see how things are going to be changed and what's kind of different from the new rules and what's similar from the new rules. And we're trying to do this in a way that it was going to be clear to everybody and also be accessible for a variety of different populations. So hence we use color coding, but we've also are proposing to use these brackets over them, so that if you're using a screen reader or something like that, that you'll be easily able to kind of see which of the sections that are changed or not changed. So we have like the two methodologies for that. And for people who do have challenges with assessing things, will really value their input to get a sense if this is helpful. So, and we're hearing that it's too small on the Zoom, and I think that is on my screen. And let me see. I can make the screen a little bit bigger for it. So as you guys look over these documents, and you'll have the presentations and you'll be able to see these documents online, if there's other changes that you'd like us to make in terms of the accessibility of them, we would really appreciate your help on that. So in terms of the ones that are color coded in blue and then have these the slashes back in front and behind them, that's where we're proposing that there's a major revision. These are the things that you're going to really want to pay attention to, that there's a significant change in policy or an addition of a new policy that to a rule that is going to be added, and this will probably be the focus of a lot of the different discussion within it. The ones that are in green with the brackets, I do not know the actual words for describing these brackets, but that's the bracket with the more of a squiggly line with a point in the middle of it, is going to be where we have combined or moved similar language. So there was language in 2 different waivers or 3 different waivers on it, where it's been combined, and that there's been probably some minor changes made to try to align the language across the different waivers so that they're going to be more similar. The ones that are red and are with a cross through and have the brackets behind them, is going to be an outdated reference and language that has been removed. And then lines in which are kind of red that are not cross through is going to be an outdated reference that needs to be updated. So if it needs to be referred to a different section on it, then that section will be updated when we get the final numbers on it. So I haven't been tracking the chat. Good. Let me bring that up. Okay, and I'm going to just go through some of the things. Jesse was commenting that with the redesigns, my understanding that the CCP agencies will go away and the state will take over all case management come July 2024. And I don't know if Tiffany or Nicolette, if either of you wanted to speak to that.
I answered it in the chat, but essentially CCBs are not going away, but their case management responsibilities, along with the case management responsibilities of single entry points and private case management agencies, will go into the future CMA's responsibilities, and then future CMAs will be chosen through a competitive RFP process.
But that's not entirely true, Tiffany. Some CCBs will remain CCBs as case managers, and some of them will remain CCBs, but service providers. Am I understanding correctly?
CCBs will have the opportunity to respond to the RFP, just like any other case management agency would have that opportunity to do so.
That's that was my understanding. I am the board
Great.
president of Rocky Mountain Human Services, so
yeah, that's a great clarification. Thank you.
Okay. Any comments about the proposed format for going through the for the rules? For this is the format that would be presented. It's going to show the new rules, the sections, and how things are going to be marked up for it. And as always, if once we start presenting this, if you find it to be overly confusing and have recommendations for how we can improve it, we always appreciate your guys' your recommendations. Okay. So I'm going to go on to the next section. The next section is the listening logs. And now all of these documents are going to be live. You won't be able to make changes to them, but you will be able to see them and be able to track them. So we want this to be transparent for everybody. So what we'll be doing within here is we'll be then tracking the meeting, which it's occurring in, the regulations section on it, the stakeholder or stakeholders who provided the feedback, the specific feedback, then tracking the status of it, whether it's accepted, under review, unable to adopt, or accepted with modification, and then the rationale and the notes. So that we're proposing this as, this is one, we want to make sure that when you guys are providing a recommendation, that we are documenting it well, and that we've provided a mechanism for the department staff to be able to track it and see what is outstanding, what needs to be updated within it, what is the actual status of it for that. For a lot of the challenges and the things that we'll be doing too is that as we're listening to the discussion, if there's feedback that's been provided before or is an enhancement on an feedback that has been provided earlier, that we will be proposing to kind of combine it with an earlier component on this, because we want to help the department to be managing the workload on this, that we know that you guys will have a lot of different input on this. And what we don't want to do is create 16 different lines that are in essence addressing the same component of it, so that it's kind of overwhelming the department's ability to be able to address it, or they're not addressing the core different comments that are providing slightly different input on the same issue as part of the same decision-making process on it. So we're going to be trying to integrate this to the extent possible, and then allowing the department staff to be able to document what changes that they made based upon that input. So we wanted to get your input on it. We wanted to have this as something that is clear, that you guys would all be able to see and understand. It would be transparent, but it's also, we want to be able to facilitate the work of the department staff to be able to actually take action upon the input that you all provide. Okay, what do you guys think about this? Do you think this will work? And if there's enhancements or other changes that you want to propose on that, we'll be happy to be able to incorporate it.
Steve, as long as it is openly shared, yeah, I think it will work.
Great. Great. Okay, so the other thing we wanted to show you is we know that from a lot of you guys have a lot of excellent input on it, and that there's a lot of things that you guys end up raising during meetings, and we know that there's going to be a lot of topics that are going to come up that are not going to be directly related to the rules that we're reviewing, and there's a ton of rules to be going through. So we don't want to lose those, but part of the process will be that when a discussion like that comes up, is that we're going to have a separate document that's going to be the one for the further discussion on it, and that for this on it, that once that comes up and there's a discussion that seems it's not related to the rules, that we'd be capturing, here's the topic, here's the stakeholders within this for it, and here's the additional discussion on it. And then there'll be a status component on it, whether it's like that's already been addressed, that the department has had further discussion on it. They have scheduled a meeting on it. They are scheduling a meeting. It's been addressed in another meeting, or it's to be determined. And whether or not it's related to the rules at all. And if it's so, then we'll show the section of the rules that it is related to. And then if there's a need for an additional meeting beyond that afterwards, and the attendees that are going to be at the meeting, the time and place for the meeting, and then the outcomes and the notes for it. So we're anticipating that there'll be a lot of these things that will potentially come up, and that there'll be meetings that could be scheduled. We know that there's a lot of things that will come up that there's other stakeholder committees that these might be referred to. Those other stakeholder committees on it. But we're envisioning that as soon as an issue comes up that's not directly related to the rules and providing direct guidance to the department on how to change it, or if there's something that's coming up that is kind of related to the rules but is like too complicated to provide direct input on, so that there's an issue that stakeholders have differing opinions on and you really want to be able to flesh it out. And we know that within the meeting on the rules that it's just going to take too long and will not allow us to get through everything, then this will allow us to be able to have a mechanism for documenting that and figuring out when we're going to schedule the additional meeting to be able to address that. So we want to get your input on this. We know that this one's a little bit more complicated, but we did want to use this as a way of just directly that if there's going to be additional meetings on it, or we need to schedule a meeting on it, that we can kind of track that. So this is going to be more for the future meetings. It's not just putting it down there saying that we'll hold a future meeting on it, but it's a document, and that you can kind of see that when the future meeting, or if that is to be scheduled on it, or if it already occurred, and what was the outcome of it. Anybody have any input or suggestions on this? And again, this is not your only time. We're envisioning that we've set up these documents so that they can be flexible and we can make changes to them as the process goes along. Okay, and we'll open it up for questions. Do you want me to stop the screen sharing so we can people can be seeing the cameras better?
That's great, thank you. Any questions at all about I mean, this is mostly just kind of questions about the process, getting to the meetings.
I see, Rob, you have your hand up.
Yes, thanks, Tiffany. And I guess really I wanted to take a step back, and you guys may have covered this as I was listening from Zoom to Google, so I apologize if so. And I think it's not as so much about the process, but a timeline. I think we'd all agree that a comprehensive facelift on rules is long overdue, and this is a great effort. I guess from a time standpoint, how long we think this is going to take in relation, and specifically with CMRD looming, I'm just concerned about prioritizing a complete overhaul in relation to the major systems changes that we're facing, and that this doesn't get lost in that or slowed down because of it. I don't disagree that a whole rule revision is required, but I'm just concerned about the timing.
Me too.
I can take that one. I think that's a really fair point, and I think that all of us are feeling what you're talking about, right? The pressure of all of the changes. The rule updates about case management have to happen before case management redesign, right? We can't execute new contracts without new rules that identify the case management agency's new responsibilities, and that taking out single entry point language, taking out case management responsibilities that are associated with specifically with a CCB, right? So it's taking all of that together And so because the rules as they stand right now, that language permeates pretty much all of the rules from waiver to case management to CCB to provider requirements and service definitions, right? So the work has to be done anyway in order for us to do and execute case management redesign. So this just offers us the opportunity to have that kind of restructure and better flow moving forward.
Yeah, Tiffany's right on, because I think when we're having the discussions about changing the rules, it dawned upon all of us that it actually would probably take more work to rewrite all of them in the existing formats than just to try to put them together in a single format.
And I don't disagree. I mean, it's just like legislation. When you do all the conforming language, I get the lift. I guess I'm just concerned that we don't get too far in the weeds on particular items when one of the main priorities is case management redesign. So I just wanted to voice that concern.
Yeah.
Exactly. And that's why part of the format's going to be for the additional issues to follow up. But if there are kind of sticking points about major changes within it, those might be things that do not make it into this version of the changing of the rules, but we have that to for a subsequent revision.
As long as everybody is open to that you just said, Stephen, I'm fine with it, because I will imagine that there will be changes that we just can't agree to, unless we have enough time to study them and test them and maybe even redraft some parts of them. So as long as the department knows that there will be sticky places, like you call them, that will have to wait at the end or something like that, or later, to a later time, as long as we know that, that's okay.
Yep.
Yeah.
Yep. And this is a lot of what we're going to be doing is kind of a triage process. We're kind of going through and we're going to be sorting out, here's exactly what we need to get done for case management redesign, getting that in. Here's the other kind of stickier things that have been problems in the past and will continue to be challenging, but we've identified those. And for those stickier, more complicated issues, the department will have a good sense of it and can figure out when they can be able to address those.
Yeah.
Good.
Yeah, Elsa?
Hi, Tiffany, and everybody. Thank you so much for this. It's great information. I'm going to go back to the lived experience question, because I'm thinking about how do we make this accessible for the people that the ACL serves, which is people with intellectual developmental disabilities. And there's a need for, accommodations around these meetings, accommodations around, can we get some plain language information out there? Because I think I've administered lots of programs and in different countries, and across the board, the connecting factor is the lack of involvement of the people who those rules most directly impact. And I don't mean to throw this at your door and say, hey, you need to do that. I'm asking, how can we partner around that? And maybe that's something that we can take into a different space to have a discussion, but I just needed to say it out loud. I worry that we construct a system based on what we've already had. And I know we can align that language. I mean, goodness me, we've done it plenty of times without addressing the structural problems that lead to people not wanting these services or their health declining as a result of receiving these services. And so, I don't know, and I'm not saying that is any person's fault at all, because I have worked in every capacity in the system, and I haven't been able to stop myself from harming people. And I believe that it starts by their lack of involvement here. And so I have a commitment that I'll try and make a difference with that, but I need to have a conversation with you guys about how I can do that effectively, because we're going to need upfront information so we can prepare people for conversations. We need some plain language written materials. We need to let people know that this is happening, before their case manager tells them, oh, by the way, we're not going to be your case management agency. And that's happening already. And so I just say, please, if we need to have a separate meeting, could we really focus on the involvement of people with lived experience as one of those potential breakouts and get it right before we go too far down this road? Because uphill mistakes are much easier to unwind than downhill mistakes, because you don't make as much progress.
Mm-hmm.
And I know that it's an uphill struggle to involve people who have been so silenced by their experiences in the system. And so what I'm saying is, let's do an uphill battle with this particular thing, because it really matters. And thank you. And I'm open to in whatever way I can partner.
Yeah, I think that's great feedback, Ilsa. I think we are definitely open to suggestion about how to get the word out to more people. So maybe that is a conversation that we can have offline, or if there's a group of people who want to brainstorm. The department is working on member communications direct from the department about these changes and about the ability to get involved in the changes. But again, yeah, definitely open to suggestion.
Yeah, and I'm listening to it, actually putting it in the first component for the issues for further discussion as kind of the first line item within that. One of the major goals in restructuring the rules in this way is so that it would be clearer and easier to understand for the actual participants who are using the services within it. And changing the things to plain language, I think, could be a goal. I think in this phase, it is probably not going to be achievable, because you would probably have to rewrite everything. But I think that having, that they could be exploring an effort in which they're going through all of the language for the rules and seeing how it can be written in a way that complies with the requirements for the regulations, but is going to be as clear as possible. Could be something that we've got that documented as our first issue for additional follow-up.
Thank you. And I don't want to throw Jose under the bus, but CCDC managed to convert the Blue Book into plain language. So I know it can be done.
And what I've found is in other efforts to convert things to plain language, they've also made it easier for people who don't have intellectual disabilities to understand and be able to follow things.
Yeah, we do have some people that are able to do that. And since we already have a contract with the department to do other work in the case management redesign and this entire piece of the tool and the case management redesign, I would be happy to take it back to, if there's no other CCDC member here, I'll be happy to take it back to Julie and Hillary.
Thanks, Jose.
Yeah, Jose, I'm here too, and I'm taking notes.
Great.
Oh, hi, Mona.
Other questions or comments? Jesse, I see your hand.
Hi, I am actually a caregiver. My son is on a waiver, and I think I really appreciate what Elsa is actually saying as far as like putting getting people involved and getting people's voices included in here. And I think that something as simple as even a survey to caregivers and or families or patients, and kind of giving them a voice of, what's working and what are some pain points. And I think it's really simple. It doesn't have to be long. In fact, if a survey is too long, most people shut down and just give up. But I think just really simple, like what's working, where's your pain points, what are some input, what would you like to see, something around that. And if it was sent to all the different agencies, and then they can just send it out to their participants and caregivers and or families. I think that can be something really simple to be able to collect that data. And yes, somebody has to go through that and kind of create a little a follow-up report, but I feel like that can be something that's kind of sidelining this so that we're just cognizant of like what really makes sense in this, because as much as trying to make everything just conglomerate into one fine line of, okay, this is a blanket, that's kind of what I'm hearing. That's simple, and sometimes the best thing isn't the easiest thing. And so I just want to put that out there, that I really appreciate putting families first and getting the voice out there, because this is who it's impacting. I, for one, am somebody who receives my services from a complete different county that's an hour and a half away from me, because the services within my county denied my son 4 times before I actually went to someone else who worked hard for me and supported my application. Yeah, so I that's what I actually worry about, is any family that perhaps just, I was ready to give up, and I actually ended up meeting somebody who said, call this person. I was approved within, 2 months. Whereas again, I was denied 4 times in my own county because they said my son wasn't sick enough. So I think there's sometimes just that is something to keep, I would say, in the front of your mind, because as a parent and a caregiver, it really worries me that it's just going to be this blanket rule. And I guess there's this other piece too with the case management redesign. If you're redesigning this program, then truly supporting families and making case managers accountable, and eligibility technicians, or however it works with that, accountable to truly understanding their job versus doing the easy thing and denying people because they don't necessarily understand or know better. So that's just kind of a little bit more than I wanted to say, but in a nutshell. And I understand and can respect that this time is about rule design, but again, I think if it were easy, then these rules would already be rewritten and taken care of. So yeah. It's definitely a long haul. I appreciate everybody's work on this. And I really do like that list, Steve, that is, okay, here's some stuff that we'll put kind of in a parking lot. I just hope it doesn't stay in the parking lot. And really truly is like pulled forward each time, like, oh, hey, that's on this list, and this meeting correlates with what we're talking about. I really hope we hold strong to the accountability with this list as well.
Great. And I've captured that as line 2 on the document.
Thank you.
Thanks, Jesse. Rob asked in the chat about if there is a master timeline with deliverables, expectations, due dates. So we don't have a public-facing document for that necessarily. The memo that has all of the meeting topics and dates has the topics. So what we'll be covering, and then you can see that the deadline or the last meeting is, I think, April 11th or 12th. So that is our expected timeline. And we have built in about 30 days to have all of these rules go through e-clearance before they can be presented to the Medical Services Board, which is the group that approves all of our healthcare policy and financing rules. And we are hoping to present to them, I believe, in June. So we can try to add those details to our CMRD website timeline if that would be helpful for you all. I'm seeing some heads nodding. So yeah, we can do that. Any other questions or comments? Pat. You're on mute if you're talking. Oh.
I just have a quick question about the first slide that you presented with that got stakeholder input, Steve. And there was a comment, like column that said status, and then it was going to be completed or addressed or looking at or something like that. Was there any column for the resolution of it or the outcome of the input?
Yes, and let me bring that up.
I saw that in the second one, but not in the first one, I think. Maybe I just didn't see it.
So the first one has the status for it. So the status will give you the outcome on it. It'd be like accepted under review, unable to accept, and accepted with modifications. And then the rationale or the notes in terms of what was the outcome for it. So if it was, accepted, then we have like the feedback, and the feedback was accepted for it. But if it's, not, or the modifications, then we're anticipating that would be in the rationale in the notes section.
Okay, so maybe outcome rationale notes, just a suggestion, or resolution rationale notes.
We're actually combining it, so it was the status has the rationale for it. So if it's the outcome, if it's just under review now, that would be the status of it. Once it's done, then you would move it to accepted or unable to accept or accepted with modifications. And then that would show the outcome on it.
Okay. Is there a way to notify the person that posted what the resolution is instead of having to, have people sort through 152 million comments? No, only kidding. Maybe 152.
Well, this is just set up as a Google sheet, so it's just a simple Excel spreadsheet. We didn't want to invest a lot in figuring out a complex system for everybody to be able to use. However, we will be entering the stakeholders' name associated with the comment so that you could easily go through the sheet within it, like see your name, and I think you could even sort by your name and see the ones that are related to you if you want to see the status.
Okay, thank you.
You're welcome.
Any other questions, comments, feedback, suggestions? I see someone with the name unknown with a hand up. You can go ahead.
I realize this is all specifically regarding the rule design, but about a year ago, I was involved in the discussions of the actual case management redesign, like the boundaries and the maps and the changes and all of that. And I have not been contacted since I sat in on a call when they were talking about the proposed boundary changes and grouping counties together and things like that. Is there a place that you can direct me to where I can catch up on some of what I probably have missed? Like, is there a different link or where we can follow up with what is going on that aspect of it, separate from the rules specifically?
Yes, so our website has all of those updates. So it has our timeline. We have some frequently asked questions. There's the space for the rule revisions, and then any of the memos that we have posted are in a specific section. So instead of scrolling through, you can go to this site, this link, and it'll take you directly to the part of the web page that has the memos that were created with those decisions that were made based out of that input.
Okay, super, thanks. And a follow-up to that is, it's been a few years that I've been involved. I've been up to HCBS and met with various people regarding waiver changes a few years ago when there was talk of implementing a cost for some of us on certain waivers. And, you know, you guys say that you have meetings with quote unquote stakeholders. And I know Jesse mentioned this, but truly the stakeholders are the families and the people that are receiving these services. And it seems like we have a meeting like this, and I do appreciate that this is long term. Every 2 weeks, we're going to be able to come here and keep up on things. But so often I attend a meeting, I give my contact information, I ask to be involved, and then there's no proactive contact or outreach from HCBS to truly involve the families and the people that are in the end affected by this. So then all these decisions get made. So you may take a little bit of feedback and make us feel like we're actually having an impact when we're probably not really. And then we never hear the outcomes. We never get to know what happened. And then by the time we do, it's too late. So I just ask for really, truly, those 100 of us or however many people are on this call right now, we really truly have a vested interest in this. And I really hope that you guys will. I saw that you put an attendance thing on here, so I filled that out with my email address. I really want to make sure that I am on that list to be contacted, even aside from these meetings every 2 weeks. If there's a change, if there's something that comes up, I'd like to be able to be involved where HCBS is proactively letting us know what's kind of going on outside of these meetings every 2 weeks in a way that's appropriate for us, of course.
Sure. Yeah, I appreciate that. Are you signed up for the constant contact messages?
I signed up like 4 years ago, and I don't think I've ever gotten anything.
Oh.
I've signed up in person in the office when I was there for some other meetings.
Huh. That might have gotten missed then. I don't see your name. It's not coming up on your kind of little square.
Sorry, I don't know why. I'll put it in there.
That's okay. If you would put your name in the chat, then we can identify you through the attendance. Yep, and make sure that we get you connected with that list.
Wonderful. Thank you so much.
Yeah, no problem. Lene.
Hey, good morning, everyone.
Good morning.
Lene Flora from Jeffco, and the other person speaking was actually echoing a little of my own frustration because I couldn't make it until now, so I missed a lot. So I apologize for that. But I had to ask around for the link to this. I had put this on my calendar because I had found in a different email that memo, which was just pasted into the chat. If you take that memo and you go to the links, I don't know where it is to find the link to where we all are now. And I had to call somebody else who had it. It is buried. So it's not easy. And for those who, you know, I'm not a parent or a mom like the last person, but I have the same frustration. And so is there an easier way? Plus I'm clearly not on the list either. So, and none of my staff were either. So I don't know what the constant contact thing is, but maybe you can put something in the chat that's like zings us right to how do we get to these, because that just gets you to your main page. I don't know where that is on there. So, okay, I'm done whining. Nice to see you all.
That's okay. Nice to see you too, Lene. So you're asking for the link for these meetings. Yes?
Indeed, yes.
Okay, so that is on the stakeholder calendar. If you go to the OCL stakeholder calendar, it has the calendar invite. It has the information, and it will be the same. Today is sort of, we had some technical difficulties, and so we had to switch over to Zoom to be able to share our screens. But there is a stakeholder calendar where we put all public facing meetings on that calendar. Nicolette will talk in just a minute about where you can find that, what is on there. But this meeting will have the exact same Zoom link and password every single time. So if you found it once, hold on to that, put it in your calendar invite on your calendar. It will be the same from here until April.
Okay, so the link, it was hard for me to do that because then I can't see you, but I went to that link and I'll have to mess around. I've never seen that one before. And the first link that was in the memo that talks about these goes to your main page with that wonderful graphic that I don't think has any links. So it's just making it hard for a lot of people. And I don't know if these get sent out. So it's just, I'm sort of echoing the other person who was talking as well.
Yeah, and Ryan just put in the link to the Constant Contact sign up.
Okay.
So you can click there and we will, so one of our action items that we'll take, Nicolette, is we'll send out reminders about this meeting. It will be every 2 weeks from now until April.
Thank you.
Yeah. Any other questions, comments, feedback? This is really helpful for us to know how to get in touch with you, how you stay up to date. So thank you, everyone.
Did you see that in the chat that I haven't done this yet? The Constant Contact sign up has a lot of topics to click. Which one will keep us informed about this one?
Yeah, great question. And I haven't been in there recently to know what to click. So let me just try to do that real quick.
Hey, it's Ryan. So the first link that Lana put into the chat, that is to the overarching department newsletters so that you can subscribe to. So some of the things that some of our OCL stakeholders like to check is like electronic visit verification, community first choice, department at a glance, or our case managers corner. The one that I put into the chat is our actual specific OCL constant contact that John Barry sends out twice a week. And so that one should just have, when you click on it, your email, your first name, your last name, and then you list yourself as a member, a family member, advocate, provider, county, other, however you would like to identify yourself, and then hit sign up. So there's 2 ways to engage. It's just this one that I put in is specific to the Office of Community Living. And the one that Lana put in the chat is the overarching, larger, all of healthcare policy and financing, because as we know, there's lots going on in all the different sections that we work with.
Great. Thanks, Ryan. That's super helpful. And the constant contact that John Barry sends out is how our team for Case Management Redesign really gets the word out. So if you're looking for how to stay up to date on OCL, that really is the easiest, fastest way to get on the list, get all of the emails. That has all of our stakeholder engagement opportunities go through Constant Contact. All of our memo notifications goes through Constant Contact. So my apologies to those of you who have signed up and it didn't seem to work. Hopefully this time around, we can get that to work for you. All right. Any other questions, comments? All righty. Well then, Nicolette, you want to close us out?
Sounds good. For those who didn't get to meet me on the other Zoom link, that was all me. I'm Nicolette Anderson Cordova, Case Management Redesign Community Liaison. I am also a waiver mom, so there is somebody that kind of helps represent that piece of it. I also helped do some of the project management behind this. So whoopsies, that was me with the wonderful project management and forgetting to get the Zoom link host ID. So that was on me. So for these meetings that we are getting together, we have a lot of projects in the mix, as many of you know, with Case Management Redesign. So we are in kind of a constant change. So to speak to some folks that were having troubles getting into this, I would say to like all of those, you know, getting on all of those resources that were put in the chat are the best way to keep up to date. And I'm going to put this in the chat again too. This is the link to the web page for Case Management Redesign, but it is also for, it goes directly to this project. And we've taken back some really good feedback. So here in this particular place is where you'll find those listening logs, is where you'll find kind of what we've done to update the future meetings. We don't know what all of those are just yet. We're hoping that the next 3 that you kind of see on the list are going to go as follows. But again, because we're kind of cross-mingling with so many other projects within the department, we may have to move around some of those meeting dates. I know some people talked about upcoming holidays, things like that. So we want to be really cognizant of all of that and to try to get everybody that we can to be able to attend. So any kind of updates that you want to see for this particular big rule revision project, I would definitely take this down, and keep that and save it. And we will be able to update that as much as possible. And I'll get some of those more timeline updates on the web page for you. I'll make sure that we are going to the correct place and that we have that host ID, and it really should be that same Zoom link moving forward. Did I catch everything there for kind of our changes and everything?
I think so.
Great. Is there any questions about that, about the scheduling, where to find the information? Any questions at all about any of that? Any other questions about anything else regarding roles and the meeting structure? No? All right. Well, we're so grateful for all of your time. This is really important to us, this role revision. Oh, I will go ahead and let Jessie.
Sorry, just one quick question. And you may have mentioned this, but I just want to make sure. As far as for preparation, before each meeting, will you guys be putting out what your agenda is going to be so that it will be easier to stay on topic? I know we went off topic, which I appreciate that you guys were willing to answer our questions. But given that the kind of task at hand is changing rule, revising it, is there one, the agenda, and then also 2, on that case management webpage that you sent us, will there be like a copy of that rule that we'll be reviewing to just kind of keep everybody on point?
Yes, ma'am, absolutely. So when you go to that topic area for the web page on the link, you're going to see a header that says rule revision documents. 1 week before each meeting, we are going to be posting the documents of the rules we're going to be reviewing for that following week. So it gives you all a week to kind of be able to go through it. And then of course, we're going to go through it all with you during those meetings. So that was a great point too. To your point, like this is more kind of the open engagement to let everybody know what's going on and how it goes. But you're correct. Once we get to the actual rule structure and the rule changes, the flow is going to be much different. We're going to have to stay very on point to the rules. If there is anything that kind of gets off topic, that's still pertaining to the area of the rule we're speaking in, we're still going to track that and log it and make sure that we try to give everybody, through those listening logs and everything, details of what we did. But yeah, it'll probably be, we have a lot of rules to go through in brief amount of times there. So it will be a lot more structured. And before, we'll go over sections of the rule. We'll pause for anywhere from 2 to maybe 15 minutes, depending on how much rule we have to go over to do questions, document them, and then move forward through each one. So they will all be on that webpage as well. Did I answer your question?
You did. Thank you, Nicolette.
Yes. Is there any other questions? That was a great question, by the way. Thank you. All right. Well, good. I really hope to see everybody back for the next rule revision. It's so important that we make sure that we get these right, that everybody has their input, that these rules are going to be easier for all of our stakeholders, our family members, our self-advocates. It's incredibly important, and we're so glad that you all are here with us. We are going to say goodbye now, and everybody have a really wonderful rest of your day.
Thanks, everyone. See you soon.
Bye.
Bye.